Good afternoon, everyone. We're going to begin in a minute. We're just letting the people come into the webinar. So welcome to the Suffolk County Vaccine Update. So good afternoon, everyone. Welcome to the Suffolk County Vaccine Update. I'm Anthony Forgione. I'm the Director of Business Development for the HIA. We're very excited to work with Suffolk County and bring this program to you. Before we begin, I also want to thank or recognize our Board of Directors who have been very supportive to the HIA through this whole COVID era that we're in. So I want to thank each one of them for all their support. Now, because we have a packed program, let me introduce the President and CEO of the HIA-LI, Terry Elisi Maselli.
Oh, thanks, Anthony, and welcome again, everyone. Hope you are all staying healthy, strong, and Long Island strong in particular. So we appreciate you being here. This is a very important program for several reasons. I mean, many of you have reached out to us and asked us about availability and eligibility and distribution of this vaccine. You know, we know several things, right? So 2021, well, absolutely see some challenges, but this vaccine and these vaccines in general show us promise, show us hope. There's an end at the end of the tunnel. I mean, we're almost there. We're so close. So we appreciate again all you being here. So this program will really evolve around giving you some critical information and also asking you about the sense you have of support that you might need really to get the vaccine to these people. Let me just say before I introduce the county executive that we are so proud of each and every one of you as our members. We have seen you repurpose your plants to give out equipment. We have seen you very specifically this morning and the last week really give critical guidance as it relates to the stimulus funds and how to get those funds for many small businesses. So thank you. Know that the HIA-LI is here along with you every step of the way. And by the way, we have always been grateful, by the way, to the county executive. We couldn't be more grateful now more than ever before. I don't know of any other person who could have led us so swiftly through this. And I mean that, county executive. You and your team are just phenomenal out there, just communicating. And that really has been what this is all about. So thank you from the bottom of our heart. I'll introduce the county executive in a moment. I do want to tell you that who we have with us this afternoon is the Suffolk County Health Commissioner, Dr. Piggott, who we'll hear from, the Suffolk County Commissioner for the Department of Economic Development and Planning, Natalie Wright, who is with us as well. Chief Deputy County Executive Lisa Black, who is also with us, and the Suffolk County Commissioner of the Department of Labor, Rosalie Drago. So again, couldn't have a better team. I'm going to turn it over to the county executive. We are going to remind you that if you have any questions, please put them in the bottom in that chat area there, and Rosalie will be facilitating that so we can have an open dialogue as well. Thank you and welcome, county executive.
Thank you very much, Terry. It's great to be with you. Great to be with all of your members, of course, and the HIA, as I will always say, really is an incredible organization, and the members and the work that everyone does to build our economy, strengthen our economy is absolutely critical. And I'm, as you talked in the beginning about this new year and where we're going and the light at the end of the tunnel, all of that is true. We have some real challenges ahead still, but I am really optimistic about the future, and particularly when I think about you know, the Innovation Park and the work of the HIA. That is one of the biggest reasons why I have such optimism. I'm really excited about the opportunities that will be here in a post-COVID world. But we are thinking about those things, but we have a lot of work to do to get there still. And I do want to thank you for your comments about the team. I cannot emphasize that enough. We have an extraordinary team here. Our commissioners, led by our Chief Deputy County Executive Lisa Black, they're doing a phenomenal job, and I want to thank them on this call. And our health commissioner, who came on about 2 days before COVID hit in the county, so he has great timing.
Yeah.
But I want to thank you for the opportunity to talk about this, because obviously this is both a critical issue right now because of the attention and the focus on this as this vaccination effort has really gotten underway, and also because it is our pathway to finally be able to say that we have gotten beyond COVID-19, and so much has to be done to get there, but this is the means by which we will do it. So to give a sense on where we're at, just generally with respect to the virus itself, we had, through the holiday season, basically a 2-month period of just a straight trajectory upward in positive cases, in hospitalizations, and unfortunately, the resulting inevitable increase in deaths as well from the virus. So to give a little perspective on that, at the start of the holiday season, that Halloween weekend, October 31st, November 1st, at the start of November, we had a 1.2% positivity rate. We started January, just a little more than 8 weeks later, hitting 12.8 positivity. November 1st, we had 42 people in our hospitals. January 1st, we had well over 800 people in the hospitals. So that is just over an 8-week period. And of course, unfortunately, we know more people get COVID, more people end up in the hospital, and more deaths result. In November, we had 35 people die from COVID-19. That was more than the 3 months prior combined, those deaths in November. In December, that number jumped to 230 people just in a 4-week period. And now January, we started December with 287 people in the hospital. We started January with 800 people in the hospital. So, you know, you only have to look at those numbers to understand we have some of the roughest weeks ahead and months ahead when it comes to dealing with this virus and the health impacts and the impact on families. So if I can say some good news with those numbers, what we'd always hoped is we get through the holidays, which is really people gathering with families, loved ones, friends, and lots of gatherings, which is where we've seen so much of the spread, that after the holidays, January, we would start to see those numbers stabilize and get those back under control. So over the last 5 days, our numbers have gone below 10% positivity. So that is a good sign that we may have peaked. I can't say that for certain at this point, but I do believe that people are limiting those gatherings now. I do believe people are following the guidance. They've been following the guidance, certainly outside the homes, in stores and places, and that's been a big help. But if we can get those numbers back under control, as we are starting the vaccination progress, we will put ourselves in the best position to protect public health and to recover as well. The only other concern, of course, with respect to the numbers is this UK variant, which we still know, we don't know an incredible amount about. But the thing that we've heard about this strain of the virus, of course, is that it spreads much more quickly. It's not necessarily more deadly, but it spreads much more quickly. So that creates an even greater sense of urgency now that we know it is here and it's confirmed that it's here. We believed it's been here for a little while, that we get the virus under control through the vaccination process and through our own behavior. Because if this does truly accelerate transmission of the virus, then the lower these numbers are, the better shape we're going to be in from a public health perspective and again from recovery. So with respect to the vaccinations, a lot has changed and shifted in just a week's period of time. we launched our vaccination pod back a week ago. It seems like a lot longer than that now, but it was last Wednesday was our vaccination pod. Now, what is a pod? It's the point of dispensing. That's what it is. And we didn't just come up with that term, a week and a half ago. This is part of what we do and have been doing really since, I think, 2002, multi-agency comprehensive planning on a regular basis involving different levels of government in which we update our plan. And that plan includes creating and opening these vaccination pods that will allow us to vaccinate, mass vaccination for exactly this kind of event, a pandemic. So we have these plans in place to do mass vaccinations so we can get as many people vaccinated as quickly as possible. Now, when we launched that pod a week ago, and this is at Suffolk Community College, we have an agreement in place with Suffolk Community College to utilize the 3 campuses, which are spread across the county in Brentwood, in Selden, and Riverhead, to do mass vaccination sites there. In addition to our community sites, there are the hospitals, of course, have been doing vaccinations of their employees and the people that are part of their networks, physician networks, et cetera, and of course in nursing homes. But when we launched that pod last Wednesday, there were approximately 90,000 people in the county who were eligible to be vaccinated. That's because the first category is category 1A, and that included healthcare workers, so people on the front lines directly dealing with COVID patients and part of the health systems that will be necessary to, of course, vaccinate the rest of us, and also nursing homes, their staff and residents. Obviously, very appropriate. These are the people who are most vulnerable to the virus. So that was the category 1A, about 90,000 people. 2 days after we opened our pod, the state announced that we were expanding to group 1B as well. There were a number of states that already were doing groups that are part of 1B, which speaks to the, I would say, decentralized nature of the way this has rolled out. I would analogize it similarly to testing. You saw there wasn't, one national strategy. Was really left to the states individually. So here you have, again, I think, vaccinations where different states were starting to do different things with the same supply, by the way, but doing different things. And so New York probably was one of the latter states to add or move to a 1B. Now, who did that include? First responders, police, firefighters, also educators, teachers. Obviously, schools are a priority in keeping them open. And importantly, it included those who are 75 and older. So now, for the first time, you're moving beyond a core group of institutional employees, whether it's in the healthcare industry, the law enforcement, or education, to now the broad population, not just any cohorted group, but now, just generally speaking, anybody who fits that criteria in the general population, 75 or older. I would point out also the population that is going to have the most challenge navigating any system that involves technology, websites, links, and obviously having to make appointments. But that is the most vulnerable group, and they're part of Group 1B. So that dramatically expanded the people who are eligible. A couple days after that, the state, following the recommendation from the CDC, which I think came out on Monday, that 65 and above should be vaccinated now, the state followed suit and made the population 65 and above eligible as part of Group 1B. So what did that do in effect? That took us from having 90,000 people eligible to be vaccinated when we launched our pod on last Wednesday to now 600,000 people in our county being eligible to be vaccinated. Over this last week, the supply has not shifted in any way whatsoever. The supply is extraordinarily limited right now. We had 2,500 vaccinations over the 4 days that our pod was open, Wednesday through Saturday. We moved through them very quickly, but that is the supply we had. We have an additional 500 that were actually, for the first time this week, our pod has been shuttered for the last 5 days. We're able to vaccinate people today, about 500 vaccinations. In addition, Northwell had donated approximately 400 or so that we've utilized to start vaccinating police and correction officers. So you can tell by those numbers, these are very limited supplies. And of course, the result of that, everybody on this call is very familiar with what high demand and low supply means. It's a very, very challenging situation. To give you a sense of where we are at and what the pandemic plan includes with respect to vaccinations, it is obviously standing up these mass vaccination sites because the goal is to vaccinate as many people as quickly as possible so you can reduce and then stop the transmission of the virus. The higher we get those percentages up, the quicker we get those percentages up, the quicker we can slow the spread of the virus. And that's going to help all of us. It's going to protect public health. It's going to help our economic recovery as possible. So how you do that as efficiently as possible is to first stand up these mass vaccination sites. So the first site is that Brentwood site. Right now, with the infrastructure we have in place at the site, we could immediately do 1,500 a day. Again, I ask you to keep in perspective, we did 2,500 over 4 days because that's the supply we had. But our capacity right now, just with what we have there in terms of chairs and registration equipment, we could do 1,500 a day starting right now. That site is expandable up to 5,000 doses a day. So we could do huge numbers at that one site. We also have the Selden and the Riverhead camps. This is important because we want to have sites too that are spread across the county. So those sites, we can do 2,000 a day at the Selden campus, 1,500 a day at the Riverhead campus. So you're talking about nearly 9,000 doses vaccine administered on a daily basis at these mass vaccination sites. Now, obviously, we're not close to that with respect to the supply. Now, I wish I could say that I could give you a definitive answer on what the supply outlook is going to look like in a week, 2 weeks. What I know is that it's going to get better as we move forward here. I just don't know the timing of that. You know, this is launching at the same time, of course, that we're having a transition between two presidential administrations. You know, not the best timing for this, but it is what it is. You deal with what you have. So that's the reality. My hope is that this is going to accelerate. The supply is going to accelerate. How could that happen? More vaccine companies come online that have approved vaccines that could be utilized. Obviously, more production is happening every day, so you get more supply being put into the system. So if those supplies really start to go up, that flow from the federal government down to the state, down to the local communities, we can start getting those vaccinations up, expanding out the mass vaccination sites, and really be vaccinating thousands of people a day. We need to get to the point where we're vaccinating literally 15, 20,000 people a day. That's where we want to be so that we can do this as quickly as possible. but we can't do that without the supply. So one of the discussions that we're having here today, which the governor has talked about and which we've talked about as well, is ultimately getting to the point where you can have what we would call community-based sites, whether they're set up in, say, schools or even potentially in businesses. There is a way to develop and establish a local pod, so to speak, that community-based that would be for a particular business, particular cohort, if there are institutions, businesses that are interested in doing that. There's a process to do that. And what I think this call is about is starting to provide the information on how to do that, so that the planning could start for those who are interested, who want to really look at what that process is. And I'm going to ask Dr. Piggott to give a breakdown of that. And of course, Terry will share that information with everyone. And we would ask people to review it. And if it's something that they think they might be interested in doing on a localized basis there, of course, we'll be available to help answer questions and provide technical assistance and assist in any way that we can. But the planning for that, it's not a bad idea for those that want to do that to start that planning now, because whenever the supply gets there, you're not just going to be able to turn it on. It's going to take some time to plan that out and to get it set up. So doing that early is probably a good thing. The priority basis, obviously, as part of the disaster plan here, is for the pandemic, is to get the mass vaccination sites up and operating and running. And then you would be moving, when you have enough supply, into more localized sites. When we get to that point, I'll be very, very happy, because it means we're vaccinating tens of thousands of people, which is what we need to be doing each week. So I'm going to ask Dr. Piggott if you could take us through just what the process is as quickly as you can. And again, we'll provide that information. We'll get that out to everybody, and people can absorb it. And those who are interested and think this might be something they would be interested in pursuing and doing, we're happy to help answer any questions that people may have as we move forward with setting those up. So I'm going to turn it over, Terry, at this point to Dr. Piggott to talk about that.
All right, very good. Thank you, County Executive. All right, so I heard the County Executive talk about the pod, or the point of dispensing for the vaccine. So that is the main way you get a bunch of people in one site to give them something, whether it's an antibiotic or in this case a vaccine, in the most efficient way possible. Basically, if you want to do that, you need to tell the State Department of Health that you are indeed a dispensing site. So you need to create what's called a Health Commerce System account. That is from the State Department of Health. That allows you access to certain modules within the Health Commerce System. And the one important one you're going to need is called NISIS. And that stands for New York State Immunization Information System. Once you have a NISIS account, that allows you to order vaccine. You're going to need to order those products that are available. Currently, there are only 2 vaccines that are available for COVID-19. That is the vaccine produced by the Pfizer company, and also the other one produced by the Moderna company. Both of them are messenger RNA vaccines. So you're going to be set up an account where you can pre-book and order these particular vaccines. Then they'll come in a certain allotment. And New York State has what they call a use it or lose it policy. So in other words, if they send you 100 doses of Moderna on a Tuesday, they expect those vaccines to be in people's arms by the following Tuesday. And so you're going to need the NISIS account. Then you're also going to have to learn how to use NISIS. And then your actual pod, your point of dispensing, you're going to have certain roles. So you need a venue, you need a site. It's got to be something big enough so that there is not an issue of crowding, because we're still in a COVID environment where you have too much crowding and not enough social distancing. You don't want your pod to become a super spreader event. So that's very important. You have a wide open air space. We know it's cold, so obviously it's going to be an indoor space. But you want to make sure that there's plenty of space for people to be properly socially distanced. Of course, everybody at your pod should be wearing a mask. Then you're going to have some kind of pod infrastructure. You're going to need security. You're going to want to be able to control people even as they access the site. Make sure that there's this orderly process for people to get into that point of dispensing. You're going to need a registration table. People should ideally pre-register for this pod. It's going to be by appointment only. And then you're going to have to use a state system called CDMS, which is the Countermeasure Data Management System, CDMS. That is also out of the state website. So you're going to create an event for that day for your pod. So you're going to need some IT infrastructure to do that. You're going to have certain amount of inventory in terms of hand sanitizer, face coverings. You're going to give out certain paper documents, things such as information on the vaccine you're going to receive. There's an adverse event reporting form that's going to be paper. So there's certain inventory requirements. Then you're going to have stations, so a registration station. And then you're going to have some kind of flow to get people from registration to the actual vaccination area. Very important that you have some kind of a pharmacy service set up in the pod, so that as you're drawing up vaccine out of a vial, like Moderna, for example, comes in a vial that has up to 10 doses in it. So you're going to need someone who's going to be able to draw it with a syringe and a needle, the amount of vaccine per dose. It's 0.5 cc's of vaccine. Or if it's a Pfizer product, you're going to have to pre-mix that. You're going to have to add normal saline to the vial and draw it up. You have up to 6 doses in a Pfizer vial. So these are things you're going to have to figure out. There's also things with cold chain storage with Pfizer, or with Moderna, you have to pull out the vaccine from the refrigerator and leave it to sit for 15 minutes before you start drawing out of the vial. So these are things you're going to need a pharmacist to run that particular operation, and make sure that each vaccine station has the syringe and the product in the syringe and the needle attached to the syringe, so that when somebody sits down at that vaccination station, they're able to give that shot right then and there. At the vaccination station, you're going to have some IT set up so that the vaccinator can input the dose of the vaccine, what vaccine it was, what arm it went into. And then you're going to need an observation station at some certain point. You're going to need to have some kind of a clinical person on site who can answer questions. When I was young, I had a penicillin allergy, I was told. I got some weird reaction with hives, et cetera. Is it okay for me to receive the vaccine? So you need a qualified medical professional who can answer those kind of questions. With these vaccines, it's important to have the observation area because we don't know who's going to have reactions, allergic reactions. The worst is the anaphylactic reaction where your blood pressure drops and you can go into shock. So you're going to have some kind of EMS provider, emergency medical service provider on site in your observation area, and an ability to evaluate somebody who's having a reaction quickly. And if necessary, do emergency medical treatment on site and get them off site into an ambulance, into a hospital expeditiously. So all that is going to have to be in place for your pod. So there are a lot of moving parts. It's not just as simple as, okay, let's just, give a few shots today and call it a day.
So Dr. Piggott, as you're speaking, and thank you because you're giving so much important information out. I'm getting texts from some of the people that are with us today asking if there is yet a link that might get them to this information, and or if not yet, because I realize it's new information.
Thank you. Who is that?
Will there be a link that we could possibly send them? Because we have a lot of manufacturers right now on this call.
Yeah, Rosa, I don't know if you want to comment. I know we had some educational materials that we're going to send this group.
Yes, we will send out a follow-up to everything today with as much information as we have. And we can go through the questions that were being asked in the Q&A on screen too, if you want to do that at this point. But yes, we'll send out follow-up notes on the meeting, a recap, and whatever links we have.
Okay, great. Thank you.
All right, the other important thing is you need 2 shots. You have to have a mechanism to get those people informed that they need a second vaccine, and you want to be able to register them for that second vaccination before they leave your site. So that you have to set that up also.
So at this time, I will go through some of the questions on the screen. So really just to recap though, there's 2 options, right? We're gonna get our as soon as we have a supply, we're gonna have the mass vaccination locations. And then some people have asked about having their own pod. So one of the things we wanna talk to after we answer the questions is, what are you doing as a manufacturer to assist employees? Are you thinking that you're going to be providing transport or need transport? Or give people time during the day to get those vaccines. So we would love to learn a little bit about your plan or questions you may have, but I'll run through the questions real quick. We had a question about the current plan, which I think we covered. A couple of questions about healthcare companies that are not hospitals. So for example, laboratory and testing staff, how do those organizations who are not part of a hospital system but are in group 1A obtain access to the vaccine?
That's the question of the day. How does Suffolk County get access to the vaccine? I would tell you that Steve mentioned some numbers before. We have 600,000 people eligible in Suffolk County right now in 1A and B, and we received 600 doses last week. So we as a county are having difficulty trying to access that vaccine. So as soon as we know about more of its availability or where it's going to be shared, we will share that information.
And I know, and we've been hearing, just continue to keep trying your links online, right? There's a lot of traffic, so don't give up on that.
There's a lot of traffic and a lot of uncertainty. We do know that there was a little debacle with the state website yesterday, and they had to wind up canceling about 30,000 appointments that were made across the state because the link was sent out early before it was authorized for sharing. So that link is now up and running this morning. Unfortunately, anybody who thought that they had that promise of an appointment was canceled yesterday. So they should have received an email confirmation from the state saying that they now have to reschedule. So that link, I know as of today, is live. I'm getting a ton of incoming that people are trying to make appointments on that.
We have a question about, aren't immunocompromised individuals age 16 plus and 1B? And if so, why is it that upon registering for the vaccine in New York State website, that's not an option listed? I think that may be a state question.
Mhm.
Yes, I've noticed that on the state website too. Those under 18 are not able to utilize the Moderna vaccine. Is that accurate, Dr. Piggott?
Yeah, Moderna is for 18 and older, Pfizer is 16 and older.
So this one reads from Ignite Long Island. We saw how organized the teachers were when 1B opened. They effectively got their workforce vaccinated statewide by working with their regional medical providers. We believe the essential manufacturing will be in 1C or soon. Is there any guidance you can give us on manufacturing support organizations to organize our members so they can effectively vaccinate our workforce? Or should we be talking directly to Northwell or another provider? So I think the question there, for our team, also maybe for Terry, is if we're looking at a sector like manufacturing with similar work shifts and similar patterns with their workforce, is there something we should be doing differently? Or, is it coordinating transportation to the existing sites, Lisa?
Right. So I think there are a few, that was a loaded question. So thank you, Patrick. Thank you, Patrick, for that. What I can say is that the teachers, it wasn't just teachers that were eligible in 1A, right? Teachers were not eligible in 1A. It was their medical professionals. So they have nurses, they have social workers, they have school psychologists and the like, medical directors that are on site. They were all eligible because of their profession, not because of where they worked or their employment center. So they became eligible in 1A. They did, the School Superintendents Association, I'm talking with later today, they're a very organized group, and they have been giving toolkits to each school. This is how you do testing. This is how you do that. So to the extent that you can also develop this toolkit for podding, I think that would be helpful. And we, again, as the information that Dr. Piggott relayed, we're gonna put on paper for you, so you can have that. In addition, because as the county executive said, we're going to be doing 50,000 vaccinations per day at some point with our 3 sites. If you have issues with mobility and trying to access our sites, we need to know about that. If some of your employers are not able to access those 12-hour shifts, we need to know about that, so that maybe we can extend our pod in locations to account for your workforce who is unable to reach us. And then, maybe we get to the day where we're in 1C and we've already inoculated the 600,000 that are eligible now, and we can do a manufacturing day out of pod. That would be an ideal scenario, I think, for you.
Next question, will there be any priority for people in an early age group before the people that are recently eligible? So if I'm 80 and I was eligible first and now people 65 and over, I think it's first come, first serve. Lisa, is that correct?
Yeah, unfortunately, right, you only had a day or two before the 65 was able to be eligible. So it didn't give much time with no vaccine to make an appointment for 80-year-olds. So we are not able to, we've been discouraged by all accounts to prioritize any one group over another in our vaccination. So for example, when we had 500 appointments available today, they filled up in about 15 minutes. It was just first come, first serve. We know that there is a health equity piece that we have to understand here, and in that seniors may not be as technology capable as others. And so our 311 system at the county has been taking names and numbers of any senior who is having difficulty and actually helping them make the appointments, to the extent that we can access them like anybody else online. So if you're having difficulty in doing that, I would encourage you to, if you're a senior, to call 311. We are keeping lists of those over 75 and those over 65. And we're having our call takers physically help make appointments.
Is Suffolk County Community College, Selden, and Riverhead actually open to make appointments for this or next week?
We are not open at any location for appointments this or next week. We have to wait and make sure that we have vaccine available before we can make appointments. We think it's a little insincere to give somebody a little hope and then the delivery be delayed by a day and unfortunately have to cancel that appointment. So we are opening appointments up only as vaccine comes in.
Besides a pharmacist, can we have RN, LPM, or EMT administer the vaccine?
So yeah, this New York State Bureau of Vital Services out of EMS has provided an additional skills training that is required for anyone who wants to become a vaccinator. That was the goal with doing 1A first, is to essentially vaccinate the vaccinator, to enlarge our pool of resources to help us scale up so that we can actually vaccinate more individuals, because we have a bigger pool of employees who can help us do so. So for example, our police department has paramedics and EMS, and they have done the additional New York State required skills training to be eligible to do vaccinations.
In the next phase, will essential workers be eligible, and how will it be determined if someone's essential? We're military aerospace. And the next question, which could be in the same category, what group are food rank employees? Which goes?
So what we've learned is that, right, throughout this entire process for the last 10 months is that 70% of our workforce is essential in one way or another. And I think we're all just as essential as everybody else. We don't know what the state government is going to, produce by way of eligibility in the next round. We do know that the CDC guidelines had called for this industry in particular to be part of phase 1C. So, when phase 1C comes around is a best guess at this point. And we, if we learn anything, we know that Natalie and Rosalie will get that information to you as soon as we do.
Last question that was here was, can we give the number again for seniors so anyone can call the 311 number and we will.
If you're in Suffolk County, you can call 311. You can't be in Nassau and call 311. That's the benefit of us having it. And then we do also have the New York State phone number. The New York State phone number, you should know if you're calling that. I don't know it offhand, but it's something VAX. you call that New York State number, they can only be helping you to make appointments at state operated sites. That's the only access they have. So they can only be helping to fulfill appointments at both Stony Brook when it opens next week. We are looking at a state-run Stony Brook site opening likely next Tuesday. And then, as you know, the Jones Beach site opened yesterday. So those are the only two regional locations that calling that state number will avail you to appointments at.
So there's a state site and a county site. And
Correct.
then a pod if you just, when we get to your own pod. Those are the three options.
Right. I think the goal, right, in our pod planning for the last 20 years, and Dr. Piggott's taken many of these pod trainings and exercises, is that we will scale up to as large as we are able. And then as we need to do smaller pods, community pods, some of them may be for a day or two to reach specific populations that have ability issues. So, I keep talking about senior living communities. If you're an independent living community and you have 500 seniors living there, wouldn't it be easier for us to go to that location rather than have to displace seniors in so many ways? So, that's what the Health Equity Task Force is going to be looking at, and they're identifying some of those situations right now.
Joe Spinoza, by the way, from East West, thanks for putting up the New York State number. It is 833 New York NYS for Vax.
Well, I knew it was a vax. Thanks, Joe.
And how will we be notified you have vaccine dosages available?
What was the question? I'm sorry.
How will you be how will people know when their vaccine dosages are available?
When appointments go up is when we have vaccine.
Okay. So we would like to know from any of the manufacturers or other businesses on the call today, what are you doing now? Do you have any plans? Are you thinking about, offering transportation or flex work hours to help people, or changing shifts to help people get vaccinated? Anything you think you need from us?
So Rosalie, I'm wondering if, in addition to whatever goes in the Q&A, if the best way to get you that information would be for us to work together with you and come up with a very simple type of survey for these, right? And help them really so that you can get it all in one place, very consolidated, because I agree with Lisa and what everybody else said. There's so much information coming down the pike so quickly. You guys have done a great job. I can't say that enough. With what you have. So I would say to the people on the call that we're committed to doing that with the county so that we can help roll that out and, again, get you back the information you need, I think, right? Does that make sense?
Yep. So we'll work with you and Ignite and Adapt, and together we will reach everybody and get that information.
Yeah. So I did have
Terry, if I may, I just want to thank some of your partners who have already reached out independently. It's so encouraging, honestly, from our perspective, to hear from you that you want to do this and you want to do this in the workplace, because we were really afraid that everybody wouldn't want the vaccine. So I'm so encouraged by it, and I really appreciate your interest in this and your foresight into producing a safe workspace, because it's encouraging. We don't have a lot of good news these days. So thank you.
Yeah. And, I mean, Lisa, I have to say that same thing. The complete opposite has happened. What's happened is, because of the supply and demand that we spoke about, so many of our members want to get the vaccine that there's frustration with lack of availability. So I think the good news to that is they want to get the vaccine.
Right.
Oh, I did just have someone, if you don't mind, text me also a question that had to do with that, which is, I guess they're logging on to websites and they're getting canceled appointments. That probably has to do with, I guess, a lack of supply, right? What should they be doing in that case? Should they be just keeping up with it
Yeah, that's one of the things I think everybody learned early on. At this stage, I've been talking to county executives all across the state. This is obviously not just a Long Island issue, but we had county executives across the state who went into NICIS, like Dr. Piggott explained. They made their request for vaccines. It may have been, 700 that they requested for that week, and they only received a 300 shipment. And so they are now having to go and cancel vaccines. We took the opposite approach where everybody was mad that we couldn't book an appointment here, but we thought it wasn't fair to provide that false hope, give you an appointment and then have to go and cancel it. It's just, it's also resource heavy. So let's make the appointments when we know we have it in hand, when we know we have a pod that can be staffed, you know, for a specific amount of hours and get that out. So yes, it's frustrating. My mom is one of those people who's gotten canceled now twice. And that's why I know that the site is up today at Stony Brook, because she was able to secure an appointment this morning or this afternoon. So I hope that one doesn't get canceled. And I know that you're frustrated. So are we. You know, we've built a site. Think about the work that we did to build a site and not be able to produce. And, you know, Steve, the other day, the county executive went and showed the News 12 what our site looks like and what our capability is. It was a moment of pride to say, please, you know, federal government, send us what you have. Don't hold back those second doses. And we know that, you know, this is a really difficult transition period also in Washington. So it can only get better.
Right.
And we had a couple more questions. I just wanted to jump in there that weren't asked before. There are a couple of people who want to have the pod, so we'll send that information out, and also discuss maybe if you have multiple businesses in your immediate area you can partner with, you can leverage resources. And another question was, should you vaccinate the entire workforce at one time, or should it be done in percentages, 50%, 25%, et cetera? That was the last question.
So Dr. Piggott is the clinician here, but I'm going to give you my answer. My answer would be, don't do everybody on the same day. They may have some effect and you don't know what comorbidities or underlying conditions they have and allergies, et cetera. So I would stagger that over a period of time. Dr. Piggott?
Yeah, most people just get a sore arm with it. That's like probably more than 90% of people think, ow, my deltoid really hurts. It's like I was doing this intense workout or something. That goes away after about 2 days. Some people do get some minor symptoms, some minor aches, chills, feeling tired. But these are generally minor things, but still, just in case, you never know who in your staff might have a real bad reaction to it. So it's probably better to stagger the doses as best you can.
Thank you, everyone. We'll get notes out as soon as we can. Terry, thank you for hosting. Patrick, thanks for your questions and finding out ways to work together as a community.
Good. So thank you all. I mean, listen, thank you for being a valued partner. That's where it starts, right? And continues, and we'll get through this. I'm convinced, as I said before, there's absolute promise in the air. And I've never seen such strong people that I've seen on Long Island, right? So thank you again. We're looking at potentially doing this again, and we'll follow up as we spoke about with the survey as we work with Suffolk County. So thank you all members. Everybody stay well, stay healthy, and have a wonderful weekend.
Thank you.
Thank you.
Thank you.